Hello, we are nursing students from San Joaquin Delta College, and today we'll be giving a presentation on COPD.
What is COPD? COPD stands for chronic obstructive pulmonary disease, a preventable but irreversible pulmonary disease that results in airway obstruction. In COPD, airflow is limited, which increases inflammation and scar tissue formation. This leads to a narrowed airway, resulting in dyspnea or shortness of breath and increased sputum or mucus production. There are two categories that fall under COPD. These include chronic bronchitis and emphysema. Chronic bronchitis is the result of constant irritation and inflammation in the airway lining, leading to excessive thick mucus production that blocks the already narrowed airway, making it hard to breathe. While in emphysema, there's damage to the alveoli walls, and this means that the alveoli, which are the air sacs responsible for gas exchange in the lungs, have reduced elasticity and are overdistended, making it hard for gas exchange to occur as there's less available surface area on the alveoli.
Now I'll be going over some risk factors for COPD. The most common and significant risk factor is smoking, since it causes chronic airway irritation and inflammation. In addition, air pollution and occupational exposure are other key risk factors. Occupational exposure refers to jobs that involve frequent contact with dust, chemicals, or smoke, which can gradually damage lung tissue. Age also plays a role as lung function naturally declines over time. Respiratory infections can further weaken the lungs and increase susceptibility to future infections and COPD exacerbations. Genetics are another important factor to keep in mind, particularly alpha 1 antitrypsin deficiency. Though it is rare, it is important to mention as this deficiency reduces the lung's natural protection. Lastly, while obesity is not a primary cause, it can worsen breathing difficulties by restricting lung expansion and increasing the effort required to breathe.
Signs and symptoms for COPD include three main symptoms, which are chronic cough, dyspnea, and sputum production, in addition to other symptoms such as barrel chest, which is a rounded, bulging chest due to overinflation of the lungs, accessory muscle use, which involves other use of muscles such as the ones in the neck, chest, or abdomen to help breathe, and cleft fingers, which is when the nails are enlarged, curved downward, and the nail beds have become soft due to chronic low oxygen levels, otherwise known as hypoxia. Then there's wheezing and rhonchi, which are abnormal lung sounds, chest tightness, extreme fatigue, tripod breathing, which is a technique used to open up the airway by leaning forward and putting the hands on the knees. And lastly, weight loss.
When a COPD exacerbation occurs, the patient's signs and symptoms worsen. The key signs and symptoms we typically see are increased dyspnea, which is shortness of breath, increased sputum or mucus production, and a change in sputum color. For example, if the sputum becomes purulent, so it becomes thick, yellow, or green, an infection may be at play. Patients may also report tightness or discomfort in their chest, as well as exhibit increased coughing and wheezing. You might notice them using accessory muscles such as their neck and chest to breathe. In more severe cases, they may become cyanotic, which is when the skin, lips, or nail beds turn blue. This is a sign that oxygen levels are critically low in their blood, and it can lead to confusion, fatigue, and lethargy. As nurses, it is crucial to recognize these signs early, intervene promptly, and prevent exacerbation and further respiratory decline from occurring.
How is COPD diagnosed? So, COPD is primarily diagnosed using pulmonary function testing, especially spirometry, which is considered the gold standard for the diagnosis of COPD. So, in this test, the patient will take a deep breath and forcefully exhale into a tube. This will measure how much and how fast the lungs can move air in and out. Other pulmonary function tests may also be used, including lung volume testing, which can show if there's air trapping. Another test includes diffusion capacity testing. This measures how well oxygen moves from the lungs and into the blood. An SpO2 monitor can show how well oxygenated the blood is. In addition to these lung function testing, a patient's medical history is also very important. This includes smoking history, exposure to environmental irritants like dust or chemicals, and of course, family history. Providers will also assess for other conditions like asthma or heart failure, as they may show similar symptoms. Imaging studies are also a key diagnostic. These would include x-rays and CT scans. While they don't confirm COPD, they help identify any changes the lung may undergo, like hyperinflation and emphysema. They also help to rule out other lung conditions.
Next, we have nursing interventions for COPD. As nurses, it is crucial that we perform thorough assessments of the patient's respiratory status. This includes listening to their lung sounds, monitoring signs and symptoms, and assessing their respiratory rate, effort, and oxygen saturation. By assessing patients regularly and carefully, we can detect early signs of deterioration and intervene promptly. Another key intervention is promoting airway clearance. We can do this by suctioning the patient's mouth if needed, positioning them in semi or high Fowler's position or any position over 30 degrees, encouraging coughing exercises, and teaching breathing techniques such as pursed lip and diaphragmatic breathing. Pursed lip breathing is when you inhale through your nose and then exhale with pursed lips. Diaphragmatic breathing is when you breathe through your nose, allowing the abdomen to expand, and then slowly exhaling through your mouth. These techniques help reduce air trapping and make breathing easier. We can also administer prescribed medications such as oxygen to improve oxygenation, bronchodilators to open the airways, corticosteroids to reduce inflammation, and antibiotics to treat infections if they are present. Lastly, patient education is essential. We should teach patients the importance of receiving pneumonia and flu vaccination to prevent respiratory infections. We should also educate them about reducing risk factors, especially smoking cessation, to slow disease progression. In addition, encouraging adequate hydration helps thin mucus, which makes it easier to clear from the airways.
Management of COPD focuses on slowing disease progression, controlling the symptoms, and improving overall quality of life. The most important intervention is smoking cessation, since continued smoking can worsen lung function. Patients are also prescribed medications such as bronchodilators like albuterol and inhaled corticosteroids. These help to open the airways and reduce the inflammation in your lungs. These will help make breathing easier. Some patients may also need oxygen therapy if their oxygen levels are low. The goal is to have an oxygen saturation of about 88 to 92%. Pulmonary rehabilitation is also an important part of management. This includes exercise training, staying active, and breathing techniques to improve endurance and reduce shortness of breath. Managing nutrition with high protein, high calorie, and small frequent meals is also very important. Preventive care such as yearly flu vaccinations and pneumococcal vaccination will also help reduce the risk of developing additional respiratory infections. Monitoring and follow-up is also very important, knowing when to report worsening symptoms, and routine checkups and spirometry testing.
People diagnosed with COPD can access this community resource in San Joaquin County called the Health Plan of San Joaquin COPD Disease Management Program. This program provides over-the-phone services for eligible members with help with medication management, goal setting, transportation to appointments, access to health education materials such as the flyer on the right hand side, and also in home support, since these people and their family members will be dealing and managing their symptoms of COPD for years or perhaps even their entire life. So, having access to this community resource that is over the phone is very convenient and handy for getting the help they need in a timely manner. Another resource for people with COPD in San Joaquin County is the Better Breathers Club. This is a support group held by the American Lung Association that features discussions with guest speakers, problem solving conversations, and participation in social activities. This is a support group led by trained facilitators and held in person or online, where people with COPD can meet with others who are also diagnosed with COPD or managing other chronic lung conditions. In these meetings, people can discuss their shared personal experiences and feel a sense of connection and relatability with others so that they don't feel alone in managing this chronic lung condition. The Better Breathers Club provides people with COPD the tools they need to stay active and healthy so they can live the best quality of life they can.
And lastly, we have our references of sources that we use to create this presentation. Thank you for watching the video and I hope you enjoyed.